Welcome back to the Faculty Factory podcast. On today's episode, we have Dr. Ray Lucas. Dr. Lucas, Ray was the Senior Associate Dean for Faculty and Health Affairs at George Washington School of Medicine and Health Sciences. He has now transitioned into a new role, or maintained an old role, but he is going to tell us all about these transitions. He is maintaining his Associate Dean for Continuing Professional Education role, and then, of course, an Associate Professor of Emergency Medicine. Please do tell us your story. How does an emergency medicine doc get in faculty affairs?
Awesome. So in my career here at GW, I basically sort of found myself primarily as a clinician educator. Ran a fellowship in disaster medicine. I was the residency program director, the vice chair for education for my Department of Emergency Medicine. And I was approached by our dean. We had a reorganization of the medical center at GW about 10 or 12 years ago, and I was approached by the dean who was trying to rapidly fill some spots here and to oversee the MD program as the head education dean. And I, of course, was very flattered that he asked me. But the other thing that I had done in my career here is I was fairly involved in faculty governance and had been a rep to the Faculty Senate, twice had been chair of the Executive Committee of the Faculty Senate. So I really was sort of tuned into faculty issues. And our Dean for Faculty Affairs position had been vacant for a couple of years. And so I sort of got back to him and said, I'm flattered that you wanted me to do this education job, but I'd be sort of jumping the line and supervising other assistant deans who've been in the dean's office longer than I have. I really think there's a need to have some energy in the faculty affairs space, and essentially asked him to appoint me as the associate dean for faculty affairs instead.
Wow. So just hang on a second. How did you... Well, I guess I'm curious, why was it vacant for such a long period of time? And was it vacant because they couldn't find someone, or did they kind of just forget about it or think it wasn't important? Why was it left alone for so long?
Yeah, so we had this, we used to be a medical center governance structure here, and under a new president of the university, basically did away with this infrastructure of a medical center and separated us into three separate schools: medicine, public health, and nursing. And under the old system, the Office of Faculty Affairs supported all three schools. And so the Dean of Faculty Affairs supported all three schools. And so then we had a new dean who was just an interim dean, and you know how hard it is to fill spots when you're interim, et cetera. And so it just kind of, the office was, bumbling along and doing stuff, but just didn't have the person in place to really pull it all together and look forward, be forward-looking.
So you get into the office, so he agrees and pivots and appoints you as the senior associate dean. Did you even have any administrative support? Was there any infrastructure or programming, or were you rebuilding this like after a big fire? How did it work?
So we had a functioning office. We had an office staff of an executive director who started the same day I did, so who was also new, and three additional staff. And the basic mechanics of hiring the university-employed faculty and getting faculty appointments for everyone were there. And on the faculty development side, we had a single semi-retired pediatrician who was basically doing faculty development, which just consisted of a series of faculty development workshops around whatever topics he could get people to talk about. So there wasn't a lot of cohesiveness there, although, the basic pieces were there.
Right. All right, so you're in the position then, and what do you go about doing? How do you build it?
Well, the first thing I did was really, it was an office that didn't have a reputation for functioning well because it took a long time. We you've seen one academic medical center,
Right.
And the uniqueness of GW is that the School of Medicine, the hospital, the practice plan, for the physicians are all three separately incorporated organizations.
Yes.
In addition to that, our Department of Pediatrics is at Children's Hospital across town, again, a whole separate organization. So even though we have about 1,200 full-time faculty in our school, only about 150 of them are employed by the university. They're employed by other organizations. And so we have this faculty appointment process that was on paper and email and in files, and it just took forever to get someone processed through, and you had no idea of knowing where anybody was, whether it was in our office or the provost's office or on the dean's desk or whatever. And so it took a lot of streamlining workflow, and we actually we worked with a programmer in the Department of RT and created our own homegrown faculty application portal and basically made a paperless system for the office.
That was probably an incredible win and really set you on a good course. I'm sure everybody was happy about that.
Yeah, people were happy, and it made it a lot easier. And at any point in time, and at click, you could say, well, this is what you submitted, and you're missing this piece, or it went to the provost's office 2 days ago, and it should be back, next week, or whereas before it was 2 days of like sleuthing to see where the problem was, even when someone complained. So.
And then trick or treat. Oh, we found it behind somebody's desk. Yeah.
Right.
See, I'm weaving the trick or treat theme.
There were more tricks than treats at that point.
See, now was that a big lift for the dean to support financially building this thing? I mean, how do you go about selling somebody? Listen, you got to invest in this. It's going to be good. Versus them saying it's fine. Just tighten up the process. How do you sell somebody to invest in that, especially when money's tight? I mean, maybe it wasn't as tight years ago when you started doing this, but how does that work?
No, it wasn't really difficult. We already had a homegrown faculty database that worked well, that years ago one of our programmers had done, and he's an internal resource. We didn't have to really pay an outside person to do this. It was just a matter of getting on his list of work products to do or in his workflow. And he built the application module as an add-on to our faculty database so that once something went through, it automatically sort of put them into our faculty database and did away with that data entry function that we had in our office.
And that, just staying on this topic of databases, because we at Hopkins we're looking at Intrafolio and trying to streamline and put together all of our systems, which are mostly homegrown as well. Is your system that you built then the one-stop shop for hiring and promotion and tracking, progress through leadership positions or a participation in your faculty development offerings?
No.
That kind of data?
No, it's not truly an enterprise-wide system. We do, because most of our faculty are not employed by us, the faculty get hired through the HR platform of whatever organization that they're working for. So it's kind of a two-step process.
Yeah.
So it's not integrated with the platform that, where the ads are placed and the electronic applications for a job. That sort of stuff is in a separate system.
Yeah.
But what is nice is then when they get submitted for their faculty application to the school, not the hiring for the job, but this one, it is in a single database. We use the same platform for promotion and tenure dossiers and uploading them there. We use the faculty database as a real-time feed to our faculty directory on the website. We use it to track things like faculty conflict of interest and stuff like that. So we've managed to leverage it, I think, to as much as we could. Nice. But it's not enterprise-wide like we would all like to have.
But it sounds like it's a huge leap ahead of us, that's for sure. All right, so you build this nice system. So then what do you do?
I think the other piece that I really the two other pieces that I think I focused on there was a lot, and I think this is a common across the country from talking to my GFA colleagues, and from the faculty standpoint survey national results, we had a lot of dissatisfaction with our APT process, and the clinician educator types are really feel disenfranchised by this, how the system works or doesn't work for them.
Right.
So the other push that I had was really trying to, standardize, make sure things were standardized. I set up a task force to revise or update our APT criteria to include things like an actual definition of scholarship, positive language around team science, positive language that, contribution to a work of scholarship was more important than the actual order of authorship on the paper. So try to do some tangible things to get people to feel like the system was working for them. And then just a lot of outreach, workshops and how do you build a teaching portfolio, workshops about understanding the promotion criteria. I would go to departmental meetings, a lot of one-on-one meetings with chairs. And so I think trying to build some confidence and in the APT process here was probably my second big task. And that's really where I went into this from my background in faculty governance, because one of the things that happened when I was in the faculty senate before, and it had happened years before, and nothing that came out of it, was issues around updating our APT criteria.
Yeah.
And it's still not perfect, and everybody's not happy, and whenever you have an evaluative process of people, and there's always people that are going to feel like they should have got something that they didn't. But I think we moved the needle a little bit in a positive direction.
Yeah, you had to, and it sounds like you had a similar maybe experience that I did that you mentioned earlier, that when you start with an office that maybe has either no reputation or a reputation of that office is a place you go when you're in trouble, when you need some remediation or some discipline because something's wrong with you, that to change that culture and that reputation as being a place that is helpful and supportive and is on your side, that's not an easy lift, but as you said, it's a lot that just comes down to relationship building. So
very much so. And looking back, I think probably the best part of this job and the faculty affairs and faculty development is the relationships that you make with individual faculty, and the thanks that you get. I do a lot. I mean, I'm like everybody else in my position around the country. You do a lot of one-on-one meetings and encourage people and help them understand how the place works. And you kind of think they're going to get this from their mentor or their department chair, but sometimes faculty just need to hear it from somebody else. Right. Before it sinks in. And that's been really rewarding to me, and I've gotten a lot of, personal satisfaction out of that.
Yeah, totally agree with you. What percent effort were you when you first started off in that role, and has it grown or changed until your recent shift?
Mm-hmm. So I started as a 60% effort in the dean's office with the title of Associate Dean for Faculty Affairs and Professional Development. And my portfolio was essentially the Faculty Affairs Office, Faculty Development, and oversight of our CME office. And then a couple of years later, the dean asked me to add some more things on. I added the health affairs function because we don't really have a clinical dean because we don't own our clinical environment here. So then I was elevated to senior associate dean, so I became part of his senior leadership team. Mm-hmm. And in addition to that, I added on managing the relationship with our clinical partners, overseeing the office that did strategic planning and accreditation and things like that. So it was a lot. And so then I bumped up to 80% in the dean's office and still worked about a day a week in the ER.
Wow. That's a lot. How did you get into that strategic component and that kind of that 20% bump? How did you get that level of expertise, or how were you known as someone that he could hit up to do that work? Or was that just another natural kind of instinct with your governance interests and your background?
Well, I had been part of the team. We had done a strategic plan a couple of years before, and so I was part of the team that helped oversee that. So I think I had that experience behind me, and really, what that office did was really continue its. In some places, they're called like an Office of Institutional Effectiveness, or for the CQI standards from the LCME, does all that sort of stuff. And so and it was a well-functioning office with a really smart associate dean who sort of oversaw it. So it wasn't too much of a lift for me to do that. I think the big piece, and we had a minor reorg when somebody left, and this office needed to report up to somebody at the senior associate dean level, and it happened to be me.
Yikes.
So it was good.
So tell us about your Center for Faculty Excellence. I'm curious about that.
Oh, I'm glad you asked. That's a treat, not a trick.
Yay.
And probably,
Happy
yay,
Halloween.
Happy Halloween. And if you really want some, and that's where you get the really good candy. It's not the cheap stuff. It's the good chocolate candy that we all like to get on Halloween is in our Center of Faculty Excellence. So again, one of the things I was able to do and get resources for was to hire an associate dean for, her title's changed a little bit over the years, but currently her current title is Associate Dean for Faculty and Organizational Development. And we basically became very deliberate around our efforts in faculty development. And we had this long-standing master teacher program that was very well received, and I think we're in our 17th year or something now that predated me, and a tradition of these like faculty development workshops that were, sometimes successful and sometimes not. And so and then we had this growing community of people who were interested in leadership development and in educational research and education scholarship, especially the faculty and clinical departments who weren't real hardcore clinician scientists doing, clinical trials or biomedical research. And so we wrapped all this up into the Center of Faculty Excellence, and it's mentoring programs, leadership development programs, all things for faculty related to teaching and learning, established the Academy of Education Scholars, where you have a peer group of people that are doing education research with some support around statistics and study design. And it's been, I think, very successful, very well received. We have physical space for the center where there's, hoteling space for faculty that, are on campus and need to do something for the day. And not only, I think, have we really moved the needle and changing practice around better teaching here, and increased education scholarship, but it's another one of those outward signs to your faculty that we're here for you, we care about you, we want you to be successful, and this is something that's for you.
That is amazing. Now, was the genesis of this center, it evolved from you said you wanted to be more deliberate with the faculty development offering. So I'm curious, and when you brought in this associate dean to run these programs, was this a result of your work and your publication, your 2018 publication in Academic Medicine on leadership development programs? You did a national survey of all leadership, all the academic medical centers and medical schools, and found all the competencies and the issues and the ways many of us have these kinds of programs. And so I'm wondering, a chicken egg, did you think, how do we do this, and so you did the national survey and then you built the center, or were they parallel tracks? Did the center start coming and you hired this person and then it put you on the track to looking at these, competencies and leadership and what is it and how do we do it? How did that happen?
Great question. So I have to acknowledge Ellen Goldman, who's our Associate Dean for Faculty and Organizational Development. She didn't have a dean title, but she's an EDD, has her degree. She's got a background and teaches leadership at the doctoral level in our School of Education here. And really the vision for the Center for Faculty Excellence and bringing it all together was hers. But the leadership development, establishing a faculty leadership program was one of my initial goals when I first took the job before I brought Ellen on. And I did a fair amount of looking in and looking out about how to do something that's really going to be meaningful and effective. And we had this master teacher program already that's cohort based, already very successful. And I wanted to sort of transpose that sort of cohort model into something else. And what I found was when you go to the literature, there's like a handful of programs that really feed into the published literature on content and what works and what doesn't work. Big name things like ELAM, which we all know isn't a very terrific program. But there's many papers about ELAM, in academic medicine and other sorts of journals. But if you go to the web and you look at all the schools that do like faculty development leadership programs, they're like all over the place. Right. And you're like, they're all over the place, but what are they doing? And how come nobody else is writing about it? And what can we learn to help? I wanted to learn how could I inform to be the best program that I could build here. So that was why we did this survey, was to basically figure out what everybody's doing in their leadership development programs around the country. Right. And I think what I learned is, I dove into the leadership training literature and learned about the importance of you need a leadership competency model to frame your curriculum. And, it's not just bringing in a bunch of talking heads to talk about leadership topics. You have to have multiple, just like we teach our students and our residents, you need multiple approaches to learning in order to effectively do this. Mm-hmm. You need some sort of project base where the participant can apply what they're learning in a form of work-based learning. Then you need some you need some outcome measures as well. So doing that paper, I learned a lot. Yeah. I think I shared something with the community about what the current state is of here, and I think it helped me build a good program for us.
Yeah, it sure did. I remember when that came out, I was just bowled over. I thought, he, just reporting on when I first read the title, his program there. Great. And then I looked at it, I'm like, wait, this is a national survey? How in the world did you pull that off? And that is just huge to, first of all, get the thing organized and then implement it and get the data back and evaluate it. I mean, that is a huge lift, and it's not done a lot in our GFA family. So that was a really important contribution. And it is going to be, it is on the facultyfactory.org website, where we have a new searchable archive of really important contributions in our space. So thank you for putting that out there for us.
Well, no, and I owe some credit to the AAMC because I was able to partner with them to help do this. They have a tradition of having a sort of a catalog in the GFA portion of their website around leadership development programs, and they would try to survey member schools so they could keep that catalog updated. And they hadn't done it in a few years, and so I was willing, as part of this scholarly project, I was basically helping them update their catalog and gave them that information for their catalog. And then by partnering with them and having, this co-branded emails out to folks from both us and the AAMC, I think helped us with a really good response to our survey.
Well, that's really valuable nugget that you just shared with us. A nugget, like a chocolate nugget for trick or treat. But the nugget is that, what I like, what you just said, is that you found a way, I don't know if it was on purpose or not, but producing some scholarship that was important for you in your space at the micro level, but had the macro impact nationally for your colleagues, but also for national organizations. So that was it made sense on a lot of different levels, and the value was appreciated by different levels for different reasons. And so I think that's an important lesson to learn, that when those of us listening to this right now and thinking about projects, we all have important things that are important at our local level, but how can we leverage national interest and local interest to kind of gain some support to, and then as you said, like the AAMC, to make things happen, that it suits all of our interests to move something forward. And I'm thinking, of course, of the recent late career faculty survey that we did through the Research and Project Development Subcommittee, and that was also a national endeavor. And like you, we work with Valerie Dandar at the AAMC, who was amazing. And I love working with her because she kind of pushed our survey out for faculty members age 55 and older. And that's another example, Ray, how, we're looking at our faculty aging. And so the same with you, that what, for me on a private, personal, micro level, I'm a gerontologist and interested in aging and seeing, and Hopkins was starting to go down the road of, we have all these late career faculty members who want to remain engaged and who are retiring, and they have this, institutional memory and they're so rooted, and we really don't have much to offer them. So that question at our local level led to, of course, the national and global statistics of people aging. And so it just made sense. Hey, we all need to work on this together. And so I think that's those kind of projects that make sense vertically and horizontally are the most fruitful.
I couldn't agree with you more. And if I love going to the GFA meeting. I think I'm going to really miss that by stepping out of my faculty affairs role. But even though we all have different dynamics and a different shop, similar issues face faculty at all of our medical schools in this country. If you're going to go and investigate something or study something around an issue, it's going to be important to everyone in our community. And so if you can somehow find a way to involve others or involve more than one school in what you're looking at, I think it's important for the greater faculty affairs community to try to do that. Yeah. I think I'd like to plug the research committee and the GFA, because I think they are very supportive of, trying to bring people and projects together. And they have a little template of how to propose a study that they may want to help, sanction, so to speak, for lack of a better word. And that actually using that template helped me work with the AAMC and convince them to sort of come onto this project with me.
That's awesome. Thank you. Well, tell us, if you don't mind, when I introduced you, you said that, you're stepping out of that role, and you've mentioned it now. It's been, I guess, a month today, October 31. What were the factors that were associated with you, gearing up to making the transition? Well, first of all, tell us again, I've forgotten, how long have you been in the role, and what made you decide, or what helped you think, all right, now it's time for a transition?
I've been in the role for about 7 or 8 years. I think there were two kind of drivers for me, or a couple of drivers. One, I had this CME office that was in my portfolio. That's a good functioning office. I mean, we have accreditation with commendation. I have an executive director there who's just amazing at her job. But it's a space in my portfolio where I have not given the same level of attention as I had in traditional faculty affairs and faculty development. And so I really wanted to, be able to have some dedicated time there. But as we all know in this community, faculty affairs is at work, right? There's a lot of meetings, it's a lot of stuff, and you don't want to turn faculty away. And, you give up control of your own calendar where you have an administrative assistant who can just schedule things and put things in an open spot of your calendar. Next thing you know, I come to work Monday and I realize I'm booked solid the next 3 days straight with meetings, and it was I think it was a little personally unsustainable for me. So I wanted to scale back in a meaningful way. The other is a little so that I could focus on CME. The other two, one is philosophical. I think it's good for institutions not to have people in these roles forever. I think 8 to 10 years is a good time frame, and and that's not. I mean, I have a lot of GFA colleagues who've been doing what they've been doing for many, many years, and I'm terrific with that. But I think for a school like mine, I think some change is good. And I feel like I made positive change, I built some things, and it was time to let somebody else make it better than I could. And then the last is personal. I fell into the same trap that in my faculty affairs role I counsel junior faculty on, is that I got involved in administration way too early in my career. And it really hurt me from a scholarship standpoint. And so here I am running the APT process and counseling tenure track faculty and, other people of how to get promoted to the rank of professor, and I'm still an associate professor myself. And so I really needed some time to sort of regroup and have a little less on my plate so I can do the things I need to do personally in the scholarship side of the house so I can get myself promoted.
Wow. Thank you for your honesty, Ray. That's something. I think that's really, some important piece of wisdom there. The 8 to 10 years kind of as freshen things up and minimally acknowledging that, times change and things change and people change, and it's minimally helpful to have people at the table in our offices, in our fields of vision who have different ideas, and the diversity by all its means. Then we can get into a rut of thinking that, well, my programs are great or my workshops are wonderful. I hear good things about them. And if we don't have that humility to recognize that there are new junior faculty, new mid-career faculty, late career, anybody coming around the bend who has a good idea, but maybe don't feel empowered to offer it up because we're, fingernails clawing into and hanging on to and owning and marking our territory.
Yeah.
That can really be, we have to be more nimble as academic medicine is changing so rapidly and just everything, and with technology is changing and these disruptive innovations we talk about, we have to really be open. And I love that your sensibility of saying, you know what, I'm not going to hunker in there snug as a bug and not move.
That's kind of been my MO for my career. When I was the residency director in my department, I did it for 8 or 10 years, made some improvements, made some changes, and sort of created my own position by convincing my chair to make me vice chair of education so that I could then pull up one of my assistant directors into that role and do some, development for them and have them climb up the ladder, and then move on to another way that I could make a positive contribution to my organization.
Yeah. So. And I also appreciate your honesty, Ray, talking about scholarship generation and being promoted. It's a sensitive topic for all of our faculty, and especially for you to put that out there. I really appreciate that. I also am an associate professor in gerontology, and that's been my big bugaboo as well, because I'm not a clinician. I don't see patients, and I'm not even really doing research. I'm 100% in my dean role. So that challenge of, doing research and producing scholarship, and that walking that line of being recognized in Hopkins by the faculty as someone who's got some credibility and some chops. It's hard walking that line from faculty saying, okay, you get me, you understand me because you're in the same game. And so I feel also that pull of, I'm okay with the junior faculty and the junior leadership programs, but there's a certain bar where, the tenured full professors have the eyebrow raised looking at me like, how many harder ones do you have? And how many hundreds of publications do you have? And when was your last Nobel? Then I kind of feel like, never mind. It's just me. Just don't mind me. But you're talking about that is something I think that a lot of us, and that's why in the Research and Project Development Subcommittee, we tried to put that workshop together. And it was a pretty successful workshop, I think, in Chicago, helping our friends in the GFA world at least think about how to produce scholarship and how to do research and how to do program evaluation, all the while recognizing that just what you said, Ray, just like our faculty, we don't have chunks of time dedicated to do this. And a lot of the work, especially in our field, is not certainly not amenable to randomized controlled trials, and we don't have a lot of labs sitting around of people who will help us collect these data and do these projects. So it's tough,
Right.
and I applaud your honesty of saying, you know what, no, this is I'm tapping out, and I'm going to do what I tell my faculty to do.
Right. That's pretty much it. And and for me, I think it's the reality is as you move up, and if you want to do more in the world of academia, scholarship and rank are kind of the currency of the realm. I don't think I would want to be a dean of a medical school, but maybe I would like to be a department chair. And I don't think I'm going to be hired as a department chair or competitive in a search as an associate professor. And does it mean I couldn't do the job? No, I think I could totally do the job.
Right.
But you still need the credentials that are going to get you in the door. And that's the piece that people, I think forget about. And I think where I, in my own personal professional journey, probably got off track a little bit and, see that it's time to get back on.
Good for you, and I know you're going to do it.
Yeah, I'm looking forward to it. It's actually kind of fun being, this past month, being a little more integrated into my department because, that's where my professional identity is anyway, and I still continue to be clinically active, so that's good.
Yeah. Well, this has been a great conversation, Ray. Is there anything you'd like to leave us with before we go out to do some trick-or-treating and celebrate the Nats?
I think just to the rest of the community, I just really want to put a plug for the GFA conference and the GFA group and the committee work that goes on there. It is, if you are listening to this and you're not involved in the GFA or only peripherally involved, would really encourage you to do that. I think it's a wonderful organization. They do so much for us as a community of people that do faculty affairs and faculty development, and I think it made my life easier and certainly helped my successes in this role. And I think if you're not going to it or being part of it, you really should.
Wow. Well said, Ray. I couldn't agree with you more. That's definitely our family. Well, folks, you've been listening to Dr. Ray Lucas. He's at GW. Go check him out if you want to have him come to your place or talk to him. It's been great. I've learned a lot. I'm sure you have too. Join in next time at the Faculty Factory podcast. Check out the website. Send me your references. Go search other references. Check out Ray's article in Academic Medicine 2018, Leadership Development Programs. Thanks a lot, Dr. Lucas. Thanks for tuning in to Faculty Factory Podcast. The mission of the Faculty Factory is to build and support a community of leaders in faculty development who share tools, resources, wisdom, and encouragement in service to our faculty members, schools, and institutions. We encourage you to go to facultyfactory.org to find out more. Get in touch with me, ask me any questions. Maybe you want to be interviewed on the podcast. Thanks for tuning in to Faculty Factory Podcast. We'll see you next time. The Faculty Factory podcast and website is sponsored by the Johns Hopkins University School of Medicine Office of Faculty. For more information, visit facultyfactory.org.